I'm super excited to be on your screens. Oh my God!
We need to engage in conversation and be friendly with the kids.
It's better to have healthy sinner than to have sick saints.
And welcome to the No Podcast, where we talk about youth health and well-being. Hey besties, Salibonani Linjani, and welcome to the No Podcast, where we talk about youth health and well-being. My beautiful name is Panashe Chibata Moto, also known as the Dynamite with a capital letter D, and I'm super excited to be on your screens today, where we get to talk about the intersectionality of SRH and service provision. And I know one of the bases in terms of SRH is service provision. As young people, we are always shouting, the service that we are getting, is it good enough for us? We need nurses, we need clinicians to do better in terms of service provision. And today, there you have it, because we have a service provider in the house who's going to be helping us unpack the notion that we'll be discussing today. So as usual, I don't write solo. There's a beautiful lady, a very beautiful lady that is in the building today, and I'm super excited to have her with us. So she's going to introduce herself and also tell us what makes her heart race faster, what makes her have goosebumps. Remember, this is a young people's show, so yeah, we talk about everything. Welcome to the No Podcast.
Thank you very much. My name is Patience Musimi. I'm a nurse and I'm also the sister in charge Spillers Clinic at Zimbabwe National Family Planning Council. And we provide services to the youths mainly. Yes, I'm a young person at heart.
At heart.
Yes. So we are happy to provide services to the young ones.
Okay. So what makes you have goosebumps?
Just maybe hearing the word sexuality, it makes
It makes you feel energetic.
yes.
Okay, so I want us to get deeper into the gist of the matter to unpack the subject that we're going to be discussing today. So I don't know if you mind, if you can also tell us how long have you been a nurse, how long have you been practicing as a nurse?
Thank you very much. I've been a nurse. I qualified in 2011, and since then I've been practicing up to now.
Okay.
Yes.
Right. So as we talk as young people, when we discuss, when we talk, there are certain things that come out. There are certain subjects or notions that come out within our discussions that are SRH related. And one of the most common theme that comes out from our discussions is when young people talk about the stigma and the barriers that they have in terms of accessing SRH services. So I would want to find out from you what you think are the most common barriers that prevent young people from visiting clinics and health facilities as they seek SRH related services.
Thank you very much. Sometimes young people have one or two or a few barriers for them to access SRH services. One of them could be knowledge. Some young people don't know that I'm experiencing this. It's not a normal symptom or it's not a normal sign on my body. I should seek medical services. And sometimes they also don't know where to seek the services. Number two, sometimes they have fear that if I go to the clinic or to the hospital, what am I going to say? Maybe the nurse is going to judge me, or maybe they've heard some people say negative things about clinicians, and that alone can instill fear in a young person and hinders him or her to seek medical services.
Okay.
Yes.
So let's talk about the first part that you mentioned, which entails lack of knowledge. You say young people sometimes they don't even know what's going on their body. They don't even know when to seek help. They don't even know what kind of symptoms to expect. And I think one of the most interesting parts is that most people have been using Google. Like if you feel something, or you go on Google and you ask home remedies, how can I make this better? What do you think about that?
Is the thing with the Google is sometimes you have those home remedies, but it's not medically approved, or it's not proper for someone. Let's say they have an STI and they go maybe on Google, or they ask a friend and they hear that this herb treats this symptom, or if I jump, you cannot contract this disease. So I think young people, they have to seek services from professionals so that they get the best service.
Okay.
Yes.
What do you think instills fear in young people? Because I think we've also had some sensitization workshops that we've been having with clinicians and also nurses, like health practitioners, actually, to put them in one term. So, and most of the times you hear young people saying that, I went to the clinic and I saw someone, she was now acting like my mother, reprimanding me, and actually, this is, So what do you think instills fear in young people?
Sometimes fear comes from within, and also sometimes it comes maybe from the treatment that my friend John went to this clinic and he or she got this kind of treatment, and so maybe the nurse there is a churchmate, So I'll be afraid as a young person to go and face my elder, who is a nurse at the clinic, and I'm in the presidency now. There's that fear of being judged. Yes.
So basically, how do we make the clinical environment feel safe and welcoming for young people?
Usually, our nurses are trained. Yes, they are ASRS trained, adolescent sexual and reproductive health trained. They are youth friendly. So there's nothing to fear to come to certain FPC centers to get adolescent sexual and reproductive health services. And also we have youth friendly centers. For example, here in Harare, we've got 185 Avenue Clinic. We've got specialist nurses who are trained in ASRH who can provide those services without judgmental mindset and without discrimination to those young people. And also we have peer educators. Yes, they're there in the community, and it's very easy for a young person to tell a friend or someone of his or her age that I have this symptom, I have this problem, where can I get assistance, what can I do? And those peer educators will refer the young people then to us. So every nurse, be it he or she is at the youth center or not, yes, they have been trained. And also in hospitals, they have youth corners. Yes, in hospitals and clinics, they have youth corners where a nurse is trained and they can go to that corner now, not direct to the OPD.
Okay.
Yes, and access services, youth-friendly services there.
Okay. And I think before we started the podcast, I was actually asking you about the hard to reach areas, the remote areas. What programming are you also doing there in terms of service provision? Because some of these things, we need to take them to the community, for the community.
Yes. The youth centers are not in Harare only. We have youth centers around Zimbabwe. And also every youth center has peer educators allocated from those hard to reach areas, from those wards, and they connect the youths to the youth center.
Okay.
Yes, and sometimes we do outreaches in schools, in tertiary institutions, so that we catch them where they're already readily available at the school.
At the school.
Yes.
And I think as you're also doing that, you're collecting information pertaining to young people. And one of the most important issues that we also need to talk about is the issue of confidentiality, because I feel like it's very important that people are protected. And right now, with the age of digitalization, we have digital health systems that are in place that are being utilized, far away from our traditional ways, traditional methods that we would know. Like when you go to CNS, they would write down, and some of these things, nowadays they put them on a computer, they could put them on a laptop. So what do you think has been an advantage of digitalizing health?
Okay, let me say that currently we are in the process of digitalization, but we are still using the old system of writing in registers. However, coming to your question, digitalization, in my own opinion, I think if used well, you know, the internet, there are some who may not use it well, who may use it for their personal gains. And I think if it is used well, it makes life easier for the service provider, number one. And also, information should not be shared outside service providers, because I don't have any reason to share someone's information with you. Yes, I only share with another service provider. That is if it is going to benefit the client. But if I finished the service provision, there's no referral, there's no what, there's no need to share information. Yes.
And also just to add on that, I think we also need to talk about even the mental health of young people involved as they seek medical services, as they seek provision of medical services. How has it been like? How are you integrating their mental health in SRH?
Okay, first of all, there is reassurance. I reassure the young person that what we are going to talk is between the two of us. There is no information that is going to be shared. That gives the young person peace of mind. It opens a platform for us to communicate and to explore further what is the problem of this young person, what are his or her concerns, and how are we going to manage him or her. Yes.
So in that regard, do you think these services are reaching where they need to reach?
Yes, they are reaching the young people, but sometimes maybe we face challenges where they had to reach areas, some areas which are maybe very far from the services. Yes, there are still some areas maybe which might be lagging behind.
Yeah, sure.
Yes.
Yeah, and I also love the fact that you talked about peer education, because I think it's one of the most important and powerful tools that we've been using to ensure that young people can relate on a peer level. So how has it been for you in terms of service provision, ensuring that you have peer educators that are also carrying out and advocating and speaking the same language that you're speaking in terms of service provision in SRH?
Thank you very much. Our peer educators are trained in SRH, and then there is a work plan for them. Yes, and they report back. They bring monthly reports. Yes, so we are in constant touch with them, and we supervise and monitor them to ensure that they are providing the.
And how has been the results so far?
So far, the results are pleasing. There's interaction between the peer educators and the youths.
Okay,
Yes.
so do you personally think that if a young person has an SRH issue, be it an STI, they are comfortable and they're free to talk to you about it?
Yes, they're very free to talk
Why?
to us. Because
Not us,
yes,
you in particular, as a
myself
person.
yes, yes, they are free to talk to me. Yes.
How do you create a conducive environment yourself?
Firstly, I remove that the mother.
A mother is always a mother. How do you do it?
And wear the jacket of a professional. I'm here as a professional. And we, as nurses, we treat this without regarding the issue of age, social status, and so forth. We treat every client is equal. We don't discriminate Yes.
So they'll be free to talk to you.
Yes, they are very free to talk to me.
What about as a parent? Let's say you have children of your own. Do you actually have conversations pertaining to SRH, mostly on service provision, where you can say, you know what, you need this service, probably you're not free to come to me, but you can go. But why won't they feel free to come to you because you're their mother? So let's talk about that. Do you also have like those type of conversation with your kids?
You have to talk to them as a mother. And also as a nurse, I know that my child has this problem, and maybe anonyara kutaura neni as a mother. I refer to the other nurse, to my colleague there, batsirawo mwana wangu assist my child. And I also tell the child, like nowadays, you need to be friendly to your kids. Is like play, who is your boyfriends, and so forth. Is koningi uri kumuona sei, anditi. Yes, because you know the movements of your kids. Kunenge uchinyatsoona kuti ari kuteerwa naningi mazuva ano. Mazuva ano ari kurwara, anonoka kuenda period. You observe it as a mother. Yes, so you need to engage in conversation and be friendly with the kids, yes, so that they open up and be your friend, a friend with your kids.
Okay. I think it's very important to have a holistic approach in terms of ensuring that all the people that are necessary to ensure this person as well are also involved in that process. Exactly. Okay, so what are the main challenges that you're facing? You talked about sometimes it's hard to reach some remote areas, but I believe there is more to it in terms of probably even resources. What are some of the challenges that you are facing in terms of ensuring that services reach young people?
Usually we face challenges in communication, whereby we would want to do awareness campaigns, and probably the funds are limiting, and we want to do those outreaches and go Mzalabani Mbire, but sometimes the funds are limiting. So those youths down there are left out. Yes.
Okay. Yeah, and I think
also the medications. You know, a young girl or a young boy comes, you treat him or her of an STI, and the clinic doesn't have medication, and she don't have money. And she anotaura kumba kuti ndikuda mari ndarapwa zvakati. It's now a problem to her.
Okay,
yes.
Thank you so much for that. And I know there are young people that are actually listen, and young people are very keen, especially when it comes to service providers. They want to hear what you have to say in terms of giving them youth-friendly services, because at some point they were saying we need youth faces at the centers so that we're able to, you know, to say out whatever we want to say freely, and also an environment that is conducive for us. So what would you like to say to young people that are actually listening to you right now as your parting words?
To young people, I would like to say that feel free to visit any health center, so that you can be assisted. And if you have any problems, please don't be shy, and don't consult manesi emuzviborani emumastreets, because they don't have sometimes the knowledge on how best they can assist you. So should feel free to come to us and seek medical services. Yes.
All right. Thank you so much for that, and thank you so much for coming through. It was good having you on the No Podcast.
Thank you very much.
And there you have it, guys. It's very important when we have service providers actually saying that they are creating friendly and conducive environments and spaces for young people, so that you realize your SRHI needs and you access the right, correct, and consistent information when it comes to SRH. So I always have to emphasize this over and over again, that it is your duty and it is my duty to ensure that you get the right information every time. So from me, the Dynamite, and the crew behind the scenes, it's goodbye.